Similar as Pavelo, I thought the best way, as this is also a political sentence, is to start with that over the last days we have heard a lot about shifting geopolitics, economic pressure, and fast technological changes. And therefore, I would like to bring this conversation to something that sits underneath all of this, the health and performance of all people. We cannot build resilient economies, innovative companies, or confident societies if large parts of the population live with preventable chronic disease. Yet, this is a direction many of our systems are taking. And therefore, it's fitting that we meet in the country that gave the world both philosophy, as in the talks before, and also the modern Olympic Games. When Pierre Coubertin relaunched the Olympic Games in Athens in 1896, he coined the phrase mens fervida in corpore lacertoso, a fiery mind in a muscular body. He described the idea of combining a sharp mind and a capable body. And this is still a very powerful image of what good health and performance should mean today. However, our healthcare systems do not reflect this vision. We have built excellent services for heart attacks, strokes, and cancer. We have specialists, hospitals, and intensive care. But we have much weaker systems for keeping people physically and mentally fit over many decades. We only spend heavily when people are already ill. We spend far less on preventing illness and maintaining function. Chronic non-communicable diseases such as cardiovascular disease, type 2 diabetes, and neurocognitive decline take most of our health budgets. Many of these conditions are linked to risk factors that we can measure and change years before a diagnosis. The science to detect those risks exists. The tools to monitor and behavior and support the change exist as well. So the question is, why do we not use them systematically? On the innovation side, there's good news. We have advanced diagnostics, continuous biomonitoring, digital health tools, and AI. These can show small changes in physiology and cognition long before a doctor would normally see a problem. New therapies are arriving in metabolic medicine and neurology. Continuous innovation in medicine and biotechnology will remain important. But the biggest lever for revolutionizing healthcare, as this is our title, is not the next drug or any device. It's the mindset and the right incentives that need to be set. For clinicians, we need payment and career structures that reward keeping people healthy. This means outcome-oriented reimbursement, long-term relationship with patients, and time to focus on prevention, not only volume of procedures. A doctor who helps a person avoid a heart attack and delay memory decline by 10 years creates huge value. But in many systems, this value is still invisible. For all citizens, we need environments and messages that make it normal to care about health early in life and stay engaged. When people can see their own data in a very simple way, like with Whoop or Aura, and when they get support to act on it, prevention becomes real. And policymakers can support or block this important shift. This is where governments and payers are crucial. Rules for reimbursement, primary care, data use, and the adoption of proven innovative decide when these tools serve everyone, or mainly improve late-stage treatment for a few, as the system is working right now. If we want to move towards preventive and performance-oriented care, we need to improve quality of life and also compress serious illness into a much shorter period at the end of the life. That reduces long-term costs for health and social systems. And that's why I want to end. My own work has convinced me that health is a societal challenge, not a personal one. We need to think in decades, not in election cycles. Small choices, repeated over time, shape the health of citizens and therefore the strengths of our countries. The body and the brain are adaptive systems. We can all train them. We should not only repair them when they fail. Therefore, for me, the Olympic ideal, as presented before, is more than sports. It reminds us all that performance and well-being must be built and they cannot be taken for granted. So therefore, in the discussion that follows, I hope we can look beyond all the technical innovations and what's possible and ask now what is practically needed to implement that. What governance, what incentives, what kind of public trust do we need to make for prevention and performance to be included as an organizing principle of healthcare?